1. What is the primary mode of transmission for the common cold in children? A. Through contact with contaminated surfaces. B. Through airborne droplets. C. Through insect bites. D. Through food contamination. Answer: through airborne droplets. Rationale: the common cold spreads primarily via respiratory droplets from coughing or sneezing. Option B is correct. Option A is secondary. Option C fits vector-borne diseases. Option D is unrelated. 2. Which milestone should a nurse expect in a healthy 6-month-old infant? A. Walking independently. B. Sitting without support. C. Speaking full sentences. D. Drawing shapes. Answer: sitting without support. Rationale: at 6 months, infants typically sit unsupported as gross motor skills develop. Option B is correct. Option A occurs at 12 months. Option C and D are later milestones, 2 to 3 years. 3. What is the best way to assess pain in a nonverbal 3-year-old child? A. Ask the child to rate it 1 to 10. B. Use the Flack scale. C. Wait for the child to cry. D. Ask the parent to guess. Answer: use the Flack scale. Rationale: the Flack scale, face, legs, activity, cry, consolability, assesses pain in nonverbal children objectively. Option B is correct. Option A isn't age-appropriate. Option C and D are unreliable. 4. Which symptom is most concerning in a child with asthma exacerbation? A. Mild wheezing. B. Silent chest with poor air, breathing effort. C. Runny nose. D. Slight cough. Answer: silent chest with poor breathing effort. Rationale: a silent chest in asthma indicates severe airflow obstruction, a life-threatening sign. Option B is correct. Options A, C, and D are less severe and not immediately critical. 5. When should a child receive their first MMR vaccine? A. At birth. B. 2 months. C. 11 to 12 months. D. For years. Answer: 11 to 12 months. Rationale: the CDC schedule recommends the first MMR dose at 11 to 12 months for measles, mumps, and rubella protection. Option C is correct. Options A and B are too early. Option D is the booster. 6. How should a nurse calculate the correct dose of acetaminophen for a child? A. Use adult dosing guidelines. B. Base it on the child's weight. C. Give half the adult dose. D. Use age alone. Answer: base it on the child's weight. Rationale: pediatric doses, e.g., 10 to 15 mg/kg, are weight-based for safety and efficacy. Option B is correct. Options A and C risk overdose. Option D lacks precision. 7. What is the best pain management strategy for a child post-tonsillectomy? A. Ice chips and ibuprofen. B. Heat packs and aspirin. C. No pain relief needed. D. Morphine for only. Answer: ice chips and ibuprofen. Rationale: ice soothes the throat, and ibuprofen reduces pain/inflammation safely. Option A is correct. Option B risks bleeding, aspirin. Option C neglects pain. Option D is excessive. 8. What should a nurse do first during pediatric CPR on a 2-year-old? A. Give rescue breaths. B. Check for responsiveness. C. Start chest compressions. D. Call for help. Answer: check for responsiveness. Rationale: assessing responsiveness, e.g., shaking, shouting, is the first step in CPR to confirm unresponsiveness. Option B is correct. Options A, C, and D follow assessment. 9. How should a nurse address a parent's fear about vaccine side effects? A. Dismiss their concerns. B. Provide evidence-based info and listen. C. Tell them vaccines are mandatory. D. Suggest skipping vaccines. Answer: provide evidence-based info and listen. Rationale: addressing fears with facts and empathy builds trust. Option B is correct. Option A alienates. Option C ignores concerns. Option D is unsafe. 10. What is a nurse's legal duty if child abuse is suspected? A. Confront the parents directly. B. Report to Child Protective Services. C. Wait for proof. D. Ignore it if unsure. Answer. Report to Child Protective Services. Rationale. Nurses are mandated reporters and must report suspected abuse immediately. Option B is correct. Options A, C, and D delay or avoid legal responsibility. 11. What should a nurse teach parents to prevent SIDS in an infant? A. Place baby on stomach to sleep. B. Use a firm mattress and back sleeping. C. Add soft bedding for comfort. D. Co-sleep in the parent's bed. Answer. Use a firm mattress and back sleeping. Rationale. Back sleeping on a firm surface reduces SIDS risk per AAP guidelines. Option B is correct. Options A, C, and D increase risk. 12. Which finding indicates dehydration in a 4-year-old? A. Moist mucous membranes. B. Sunken eyes and no tears. C. High energy levels. D. Frequent urination. Answer. Sunken eyes and no tears. Rationale. Sunken eyes and no tears are classic dehydration signs in children. Option B is correct. Options A, C, and D suggest hydration, not dehydration. 13. What is the priority action for a child with a fever and rash? A. Give aspirin immediately. B. Assess for meningitis signs. C. Apply a cold pack only. D. Wait 24 hours to observe. Answer. Assess for meningitis signs. Rationale. Fever with rash may indicate meningitis, a medical emergency requiring urgent assessment, e.g., neck stiffness. Option B is correct. Options A, C, and D delay or risk harm. 14. Which developmental task should a nurse assess in a 3-year-old? A. Abstract thinking. B. Toilet training progress. C. Reading skills. D. Complex problem solving. Answer. Toilet training progress. Rationale. Toilet training is a key milestone for 3-year-olds in the preschool stage. Option B is correct. Options A, C, and D are later developmental tasks. 15. What is the best way to communicate with a scared 5-year-old pre-surgery? A. Use medical jargon. B. Explain in simple terms with play. C. Ignore their questions. D. Tell them it won't hurt. Answer. Explain in simple terms with play. Rationale. Simple explanations with play, e.g., dolls, reduce fear and aid understanding. Option B is correct. Options A, C, and D confuse, dismiss, or mislead. 16. Which condition requires droplet precautions in a pediatric unit? A. Chickenpox. B. Pertussis, whooping cough. C. MRSA infection. D. Tuberculosis. Answer. Pertussis, whooping cough. Rationale. Pertussis spreads via droplets, requiring masks and isolation. Option B is correct. Option A needs airborne. Option C is contact. Option D is airborne. 17. What should a nurse do if a child refuses oral medication? A. Force it down their throat. B. Mix it with a small amount of food. C. Skip the dose entirely. D. Inject it instead. Answer. Mix it with a small amount of food. Rationale. Mixing with food, if safe, improves acceptance without altering efficacy. Option B is correct. Option A risks trauma. Option C skips care. Option D is unnecessary. 18. What is a common complication of untreated strep throat in children? A. Improved hearing. B. Rheumatic fever. C. Increased appetite. D. Better sleep quality. Answer. Rheumatic fever. Rationale. Untreated strep can lead to rheumatic fever, damaging the heart. Option B is correct. Options A, C, and D are not complications. 19. When should a child receive their first DTaP vaccine? A. At birth. B. 2 months. C. 6 months. D. 12 months. Answer. 2 months. Rationale. The DTaP vaccine, diphtheria, tetanus, pertussis, starts at 2 months per CDC. Option B is correct. Option A is too early. Options C and D delay protection. 20. What should a nurse assess first in a child with a head injury? A. Pupil response and LOC. B. Skin color only. C. Hair condition. D. Limb movement only. Answer. Pupil response and LOC. Rationale. Pupil response and level of consciousness assessed for brain injury severity first. Option A is correct. Options B, C, and D are secondary or unrelated. 21. What is the best way to manage a toddler's temper tantrum in a hospital? A. Ignore it completely. B. Use distraction and calm tone. C. Yell back to stop it. D. Restrain the child. Answer. Use distraction and calm tone. Rationale. Distraction and calmness de-escalate tantrums effectively. Option B is correct. Option A may prolong it. Option C and de-escalate or harm trust. 22. Which finding suggests respiratory distress in an infant with RSV? A. Clear breath sounds. B. Nasal flaring and retractions. C. Normal respiratory rate. D. Good feeding tolerance. Answer. Nasal flaring and retractions. Rationale. Nasal flaring and retractions indicate increased breathing effort in RSV. Option B is correct. Options A, C, and D suggest normal function. 23. What should a nurse teach parents about preventing childhood obesity? A. Encourage unlimited screen time. B. Promote balanced diet and activity. C. Offer high-sugar snacks. D. Avoid all fats in diet. Answer. Promote balanced diet and activity. Rationale. Balanced nutrition and exercise prevent obesity per pediatric guidelines. Option B is correct. Options A, C, and D promote or imbalance unhealthy habits. 24. What is the priority action for a child in anaphylactic shock? A. Give oral antihistamine. B. Administer IM epinephrine. C. Apply a warm compress. D. Wait for symptoms to resolve. Answer. Administer IM epinephrine. Rationale. Epinephrine reverses anaphylaxis quickly, a life-saving priority. Option B is correct. Option A is too slow. Option C and D delay critical care. 25. How should a nurse position an infant post-pyloric surgery? A. Prone with head down. B. Right side with head elevated. C. Flat on back. D. Left side with legs bent. Answer. Right side with head elevated. Rationale. Right side lying with elevation aids gastric emptying post-pyloric surgery. Option B is correct. Options A, C, and D risk reflux or discomfort. 26. Which vaccine protects against rotavirus in infants? A. MMR. B. Rotarix or Rototec. C. DTP. D. Hepatitis B. Answer. Rotarix or Rototec. Rationale. Rotarix and Rototec prevent rotavirus diarrhea in infants. Option B is correct. Options A, C, and D target other diseases. 27. What should a nurse do if a child's foresight shows redness and swelling? A. Ignore it if small. B. Stop the fore and notify the MD. C. Apply heat to the site. D. Increase the fore flow rate. Answer. Stop the fore and notify the MD. Rationale. Redness and swelling suggest infiltration or phlebitis, requiring fore removal and MD notification. Option B is correct. Options A, C, and D risk harm. 28. What is a common psychosocial issue for a hospitalized school-age child? A. Improved self-esteem. B. Separation anxiety from family. C. Enhanced peer relationships. D. Better academic performance. Answer. Separation anxiety from family. Rationale. Hospitalization often causes anxiety from family separation in school-age kids. Option B is correct. Options A, C, and D are unlikely during acute illness. 29. What should a nurse include in discharge teaching after appendectomy? A. Resume sports immediately. B. Watch for fever or wound redness. C. Avoid all pain meds. D. Skip follow-up visits. Answer. Watch for fever or wound redness. Rationale. Monitoring for infection signs, fever, redness is critical post-appendectomy. Option B is correct. Options A, C, and D risk complications or neglect care. 30. Which assessment finding indicates hypoglycemia in a diabetic child? A. Warm, dry skin. B. Shakiness and sweating. C. Increased thirst. D. Clear urine output. Answer. Shakiness and sweating. Rationale. Shakiness and sweating are early hypoglycemia signs from low blood sugar. Option B is correct. Options A, C, and D suggest normalcy or hyperglycemia. 31. Which milestone should a nurse expect in a healthy 12-month-old infant? A. Running short distances. B. Walking with support. C. Writing their name. D. Counting to 10. Answer. Walking with support. Rationale. At 12 months, infants typically walk with support as motor skills advance. Option B is correct. Option A is later, 18 to 24 months. Options C and D are preschool milestones. 32. What is the best way to assess hydration status in a 2-year-old? A. Check skin turgor and fontanelles. B. Measure height and weight only. C. Ask the child how they feel. D. Observe hair color. Answer. Check skin turgor and fontanelles. Rationale. Skin turgor and sunken fontanelles, if still open, indicate hydration in toddlers. Option A is correct. Option B misses hydration. Options C and D are unreliable or unrelated. 33. Which symptom suggests a severe case of chickenpox in a child? A. Mild itching. B. High fever and lethargy. C. Few scattered vesicles. D. Clear nasal discharge. Answer. High fever and lethargy. Rationale. High fever and lethargy signal complications like encephalitis in chickenpox. Option B is correct. Options A, C, and D are typical or unrelated symptoms. 34. When should a child receive their second dose of the varicella vaccine? A. 6 months. B. 12 months. C. 4 to 6 years. D. 10 years. Answer. 4 to 6 years. Rationale. The second varicella dose is given at 4 to 6 years per CDC to boost immunity. Option C is correct. Options A and B are too early. Option D is too late. 35. How should a nurse administer oral rehydration solution, ORS, to a dehydrated child? A. Give large amounts at once. B. Offer small, frequent sips. C. Mix with soda for taste. D. Inject it for instead. Answer. Offer small, frequent sips. Rationale. Small, frequent sips prevent vomiting and rehydrate effectively. Option B is correct. Option A risks nausea. Option C alters efficacy. Option D is unnecessary. 36. What is the best pain relief method for a child with a fractured arm? A. Distraction and ibuprofen. B. Heat packs and aspirin. C. No intervention needed. D. For morphine without distraction. Answer. Distraction and ibuprofen. Rationale. Distraction eases anxiety and ibuprofen reduces pain safely. Option A is correct. Option B risks bleeding, aspirin. Option C neglects pain. Option D is excessive initially. 37. What should a nurse do first for a child post-appendectomy with nausea? A. Give antiemetic without assessment. B. Assess for bowel sounds and vomiting. C. Offer solid food immediately. D. Ignore it as normal. Answer. Assess for bowel sounds and vomiting. Rationale. Assessing first identifies nausea causes, e.g., ileus, guiding care. Option B is correct. Options A, C, and D act prematurely or neglect the issue. 38. What is the priority action for a child in respiratory arrest? A. Start chest compressions. B. Open airway and give breaths. C. Check pulse first. D. Call for help before acting. Answer. Open airway and give breaths. Rationale. In pediatric arrest, Airway and breathing are prioritized due to respiratory causes. Option B is correct. Option A follows. Option C and D delay critical steps, lone rescuer. 39. How should a nurse respond to a parent asking about autism screening? A. Say it's unnecessary. B. Explain screening at 18 to 24 months. C. Tell them to wait until school age. D. Suggest it's only for severe cases. Answer. Explain screening at 18 to 24 months. Rationale. AAP recommends autism screening at 18 to 24 months for early intervention. Option B is correct. Options A, C, and D delay or misinform about standard care. 40. What should a nurse do if a parent refuses consent for a child's surgery? A. Proceed without consent. B. Document refusal and notify MD. C. Force the parent to agree. D. Ignore the refusal. Answer. Document refusal and notify MD. Rationale. Nurses must respect refusal, document it, and inform the MD for legal/ethical follow-up. Option B is correct. Options A, C, and D violate ethics or law. 41. What should a nurse teach parents to prevent ear infections in infants? A. Use cotton swabs to clean ears. B. Avoid bottle feeding while lying flat. C. Keep ears wet after baths. D. Skip pacifier use entirely. Answer. Avoid bottle feeding while lying flat. Rationale. Lying flat with a bottle increases ear infection risk via eustachian tube reflux. Option B is correct. Options A, C, and D are incorrect or unrelated prevention methods. 42. Which finding indicates a severe allergic reaction in a child? A. Mild rash only. B. Swollen tongue and wheezing. C. Slight itching. D. Normal breathing pattern. Answer. Swollen tongue and wheezing. Rationale. Swollen tongue and wheezing signal anaphylaxis, requiring urgent care. Option B is correct. Options A, C, and D are mild or normal findings. 43. What is the priority action for a child with a seizure lasting 5 minutes? A. Restrain their limbs. B. Protect head and time the seizure. C. Insert a tongue depressor. D. Give oral medication immediately. Answer. Protect head and time the seizure. Rationale. Safety, head protection, and timing guides seizure management. Option B is correct. Options A and C risk injury. Option D is unsafe during a seizure. 44. Which developmental task should a nurse assess in a 5-year-old? A. Riding a tricycle. B. Dressing independently. C. Solving algebra problems. D. Writing essays. Answer. Dressing independently. Rationale. At 5, children typically dress themselves as fine motor skills develop. Option B is correct. Option A is earlier, 3 years. Option C and D are school-age tasks. 45. What is the best way to explain a blood draw to a 4-year-old? A. Say it's a big needle that hurts. B. Use a doll and say it's a quick pinch. C. Avoid any explanation. D. Use complex medical terms. Answer. Use a doll and say it's a quick pinch. Rationale. Simple terms with a doll reduce fear and aid understanding. Option B is correct. Options A, C, and D increase anxiety or confusion. 46. Which condition requires airborne precautions in a pediatric unit? A. Measles. B. Strep throat. C. Difficile infection. D. Impetigo. Answer. Measles. Rationale. Measles spreads via airborne particles, requiring isolation and masks. Option A is correct. Option B is droplet. Options C and D are contact. 47. How should a nurse administer 4 fluids to a 6-year-old with dehydration? A. Use adult rates. B. Calculate based on weight, e.g., 20 milliliters per kilogram. C. Give half the ordered amount. D. Skip fluids if child resists. Answer. Calculate based on weight, e.g., 20 milliliters per kilogram. Rationale. Pediatric 4 fluids are weight-based, e.g., 20 milliliters per kilogram bolus, for safety. Option B is correct. Options A and C risk overdose or underhydration. Option D neglects care. 48. What is a common complication of untreated asthma in children? A. Improved lung function. B. Status asthmaticus. C. Increased energy levels. D. Better sleep quality. Answer: status asthmaticus. Rationale: untreated asthma can lead to status asthmaticus, a severe, prolonged attack. Option B is correct. Options A, C, and D are not complications. 49. When should a child receive their first hepatitis B vaccine? A. At birth. B. 2 months. C. 6 months. D. 12 months. Answer: at birth. Rationale: the first hepatitis B dose is given at birth per CDC to prevent perinatal transmission. Option A is correct. Options B, C, and D delay initial protection. 50. What should a nurse assess first in a child with suspected meningitis? A. Skin color only. B. Neck stiffness and fever. C. Hair condition. D. Limb strength only. Answer: neck stiffness and fever. Rationale: neck stiffness and fever are key meningitis signs requiring urgent assessment. Option B is correct. Options A, C, and D are secondary or unrelated.